defines the difference between FUE and FUT hair transplantation methods. FUE hair transplantation technique.
We use a small punch tool to extract individual hair grafts from the back of the scalp, one graft at a time. One graft at a time using a small punch tool. The advantage of the FUE hair transplantation technique is that we use a small punch, resulting in small wounds. These small wounds are scattered across the back of the scalp at several points, corresponding to the number of grafts we extract. Another advantage is that we can extract hair grafts from other areas, such as chest hair. Beard hair can also be transplanted to the top area if the grafts from the back of the head are insufficient. In the FUT hair transplant technique, we extract a strip of scalp from the back, then suture the area closed. After that, we use a microscope to divide the strip into individual grafts. We separate it into smaller grafts. So the advantage is we can take hair grafts from truly healthy areas that genuinely have no issues with genetic hair thinning, and use all of them. This allows us to obtain a relatively large number of grafts each time, so we can achieve high quantity. The hair grafts we get will be healthy because we separate them under a microscope into smaller grafts. This is different from the FUE technique because we can actually see what we're doing as we divide the grafts. We can actually see the hair roots, but with FUE, we can't see the lower part. While we're extracting, we only see the surface above the scalp. The lower part might get damaged or the roots might be cut or nicked. That's why with FUE, we don't recommend doing more than 2,500 grafts, so the donor area doesn't become too thin. Also, with the FUE hair transplant technique, there will be small dot scars. There are no long linear scars at the back like with FUT. Regarding the pain, actually, there was an international doctors conference about 4 or 5 years ago where doctors who could perform both techniques were asked to give their opinions on which technique caused more pain after the anesthesia wore off. Most said that the technique FUE, if performed with the same number of grafts, tends to be more painful because the total wound surface area is larger. But let me add a bit more for those who undergo the technique. With FUT, if the back of the head is quite tight, there can also be a fair amount of significant pain. However, normally, we strongly recommend that patients gently massage their scalp to increase flexibility before the procedure. That way, there will be less tightness afterward.